Satisfaction and Sensational are products created by Enerex, designed and formulated to boost libido and performance for both men and women, or indeed satisfaction is for men and sensational for women. So first I want to say welcome everybody. Welcome to today's webinar, which is about products that are designed to enhance libido and overall sexual health. And I'd really like to thank you for taking time out of your busy schedules to attend this webinar and or to listen to the recorded version afterwards. I'm Dr. Penny Seth-Smith. I'm a naturopathic physician in British Columbia, and I've been practicing here for over 20 years. And today I'm here on behalf of Enerex Botanicals to give you a greater understanding of their products, Satisfaction and Sensational. Now, my disclosure, of course, is that Enerex is funding my time here to let you know about these products and the history and evidence that backs up the intelligence of these formulations. The overview of the presentation is this. First, we'll look at the main reasons why people experience low libido and or erectile dysfunction, and then at the aspects of sexual health problems that the products Satisfaction and Sensational are designed to address. And then there's a lot of information on the evidence behind the use of the individual ingredients in the products. You really don't need to try to recall any of this specifically. It's there to show you that the synergy of ingredients addresses a wide range of aspects of both physical and psychological causes of lack of libido and performance in both men and women. And that is whether the cause of the dysfunction or the low libido is a natural decline, whether it's in somebody going through a time of great stress, whether there's a mental or emotional block affecting them, or whether their problems are as a result of side effects of common medications. So first we'll run through the herbs and nutrients that help both men and women, because those ingredients are in both formulations. Then we'll look through the ingredients that are only in Satisfaction, because they're more specific to men's sexual health needs, and then the ingredients in Sensational that are more appropriate just for women. And then there's another important bit to focus on at the end, the contraindications and cautions with regard to people using these products. And of course, at the end, there are also the 3 questions whose answers will get you a free Enerex product of your choice when you email those answers into Enerex. If you have questions for me during the presentation, do please feel free to ask them as we go along. If you feel more comfortable, you can type them into the chat box, and we'll see how it works with folks unmuted. If we find that it's getting too many questions, then I'll mute the webinar, and we'll pause the questions until the end. And just to remind you, everybody who's registered will receive a link to the recording of the webinar so you can go back and refresh your memory if you wish to. So, what are some causes of low libido? Well, stress. And I mean, who here doesn't feel that they undergo some stress in the modern world? Exhaustion, well, that often comes after stress. Depression, well, that's obviously really common. The number of people who've been put on antidepressive medications, I think, and the focus on happiness everywhere, people seeking happiness in our culture, says that depression is really relatively common out there. Then there are side effects of medications, especially the antidepressants and blood pressure medications. So it's a tough place to be. If you're stressed and your blood pressure goes up, you may get a lower libido. Then if you take a blood pressure medication, that may also lower your libido. If you're depressed, you may have low libido. If you take one of the most common forms of antidepressants, the serotonin reuptake inhibitors, Prozac and that family, or the tricyclic antidepressants, those both are commonly known for lowering libido. Then there are hormone imbalances, perimenopause and andropause, creating low sex hormones as we get into our midlife. There are all the exogenous estrogen toxins out there in society, and there are too many to name, but bisphenol A is the most famous one of those. And they create estrogen-like activity in our bodies without actually being measurable in blood work, etc. So they imbalance our hormonal activities. Then there's low thyroid function, And T3, the main thyroid hormone that gives us energy, is necessary for testosterone production. And of course, when you've got your thyroid is not functioning well, you're going to be exhausted and you're going to be depressed. And trying to keep up with life, you're probably going to be stressed as well. And then there's steroid use, past or present, that can set you up for low libido at the time of the steroid use or thereafter. And we do know that low testosterone causes low libido in both men and women. And with so many reasons that libido may be lacking, it's good to let people who come in looking for help with this know that there are lots of other people who experience such difficulties when they're overworked or overstressed or affected by medications. You know, that someone coming into a store to look for some help in that area aren't the only ones who seek these products out. Obviously, if their symptoms don't improve or if the symptoms worsen, they should get checked out in case of any underlying disorder. But with all of these causes, it's not surprising that a number of people need help at some point in their life. And then erectile dysfunction, some predisposing factors for that. There's chronic heart disease and blocked arteries, which again are extremely common in our culture. There's diabetes mellitus, which is type 2 diabetes, which is still on the rise. Neurological problems, including multiple sclerosis. Then there's smoking, alcohol, or at least excess alcohol. There's drug abuse, and again, there's the steroid abuse, past or present. Stress comes up yet again. Poor food habits, now they are a choice. And then there's increasing age, which is not a choice. Hormone irregularities that can trigger erectile dysfunction include a high or low thyroid hormone, and you might note that for low libido, it was just low thyroid hormone, but for erectile dysfunction, high or low thyroid hormone can cause that problem. Low testosterone, and again, testosterone is important for both men and women to have a sex drive, but more important for men, it being their main sex hormone. Excess prolactin also reduces interest in sex, and that's usually due to a pituitary tumor. And then the medications. Antidepressants can cause erectile dysfunction, and some blood pressure medications can also cause erectile dysfunction. Now, having said that, beta blockers are the ones that are most commonly known for that, but if somebody did not realize that beta blockers were causing their problem, they should never withdraw fast from beta blockers. You shouldn't really withdraw fast from most medications, but beta blockers, it's really important to taper slowly, because if you taper fast, or if you come off them fast, the system can go into palpitations and high anxiety, and if that blood pressure medication has been masking high thyroid, and the high thyroid then kicks in addition to the withdrawal factors and the extra sensitivity, it can actually be fatal. So really, really important, if somebody finds out that beta blockers are the cause, send them back to the person who prescribed that to withdraw them gradually off those medications, and find another that doesn't have such an adverse effect. So with all of these causes, it's not surprising that epidemiological studies have demonstrated a high prevalence of erectile dysfunction in developed countries. And with alcohol, of course, Shakespeare knew all about that. His quote of "Literary, sir, it provokes and unprovokes. It provokes the desire, but takes away the performance." Oh, and actually going back to beta blockers, if you're not sure about which drugs are beta blockers, heart medications have a common ending in the different types. So beta blockers end in OLOL, OLOL. So that's a kind of floppy sounding OLOL end of a word, and it can create floppy kind of problems in people who take it. But that's a little mnemonic to remember if you're asking people who come in looking for these products whether they are on beta blockers. So with all of these possibilities for low libido and erectile dysfunction, it's not surprising that in everybody's life, or at some point, there's a real reasonable probability of them finding that they are in trouble in paradise. So, ingredients that work synergistically in both satisfaction and sensational to address the physical and the psychological factors that may reduce libido, may reduce sexual performance. They are stress and tension, low energy, reduced desire, reduced sensitivity, inadequate circulation, reduced response. In men, of course, that's erection. In women, lubrication. And those reduce performance. And that, of course, reduces enjoyment. So that covers most of the factors that detract from interest in sex and the performance and enjoyment of lovemaking. So now I'm going to go into the information about the evidence that shows what these ingredients do and some information about how they may do it. With each of these, first I'm going to note the historical use and then the scientific studies. The scientific studies are usually on animals, and they confirm their effects in animals, and they've also helped us to understand at least some of the mechanisms by which these herbs and nutrients work. Then there's scientific trials on humans, which are considered the best evidence in evidence-based medicine. But having said that, some trials include only 20 to 30 people and may not contain as much evidence as thousands of years of historical use. It's just that the historical use wasn't double-blinded and it wasn't collated to see how many of the people who tried this herb did well on it and how many did not. But I think it's extremely unlikely that if something didn't work that people would continue using it for hundreds of years. I know that I have patients who are more convinced by the traditional uses of herbs and others who really like to know about the studies. So I assume that you guys have clientele who feel the same, and that's why I've included both. I didn't do an exhaustive literature search, but enough to have significant evidence of the benefit of each ingredient. So the historic use of the herbs in these in Satisfaction and Sensational goes back into various ancient cultures, long histories in traditional Chinese medicine, Ayurvedic medicine, and in Andean and Western herbology. Then there are the animal studies that confirm the effects and give an understanding of the mechanisms, and where it's not plain that it's an animal study by saying in rats, I've put an A in brackets. And then there are the human trials, and those include in groups where the problems are iatrogenic, in other words, caused by medical treatments or procedures, for example, the SSRI antidepressants. And there has been a fair bit of research on that. It's obviously a common problem. And then with the trials, I've noted whether it's a randomized controlled trial with an RCT. DB means double-blind, M means multi-centered, P means placebo-controlled, and R means randomized. So the ingredients that exist in both Satisfaction and Sensational are the following. There's puncture vine, which is Tribulus terrestris. There's velvet bean, which is Mucuna pruriens. Horny goatweed, which is Epimedium brevicornum. Damiana, which is known as Turnera diffusa, and is also known as Damiana aphrodisiaca. Maca, which is Lepidium mevenii. Ginkgo, our good old Ginkgo biloba. And then 4 B vitamins, B3, B6, B12, and folate. And of course, with horny goatweed and Damiana aphrodisiaca, the clue is in the name. So the first of those, puncture vine, Tribulus terrestris. It's an Ayurvedic aphrodisiac and tonic. It's used for impotence in men and to aid fecundity in women, and fecundity means fruitfulness and fertility. Puncture vine assists maintenance of normal physiology and function, and it promotes general stamina, endurance, and well-being in both men and women. It affects nitric oxide to create better erections and for women's genital sensitivity, and they'll be saying quite a bit more about nitric oxide further on. There wasn't space for it in this slide. Puncture vine also increased erections and frequency of mounting in male rats, and it was found to help those with lower testosterone levels most in animal studies. It raised testosterone effects more in morphine-addicted rats than in non-addicted rats, so it may help some folks who are stuck on morphine in our modern world. And it was found not to have any testosteronal effects in healthy young men, so it looks like it has adaptogenic effects. And an adaptogen is defined as any substance that exerts effects in both sick and healthy individuals by correcting any dysfunction without any unwanted side effects. So it's working more in the people who need it and less in the people who don't. Punctivine also improves sperm count in a human double-blind randomized controlled trial, increased libido and sexual response, and stimulates spermatogenesis, as in the formation of sperm in male rats. It potentiated estrus and increased fertility in female rats, and it had a more significant effect on the male hormones. It affected testosterone, dihydrotestosterone, and DHEA sulfates in primates more than it did in rabbits, where it only significantly affected the dihydrotestosterone. And of course, humans are far more like primates, like monkeys, than they are like rabbits. So it looks like it's got more of an affinity with our kind of mammals. And then there's velvet bean, Mucuna pruriens. In Ayurvedic medicine, it's known as a powerful aphrodisiac, and it's used with punctivine, with tribulus, for its aphrodisiac effects. It's been shown to reduce stress and improve the quality of semen, that is both the number of sperm and the motility, the amount of motion of the sperm in infertile men. It increased testosterone in the serum and in the testes, and increased the size and weight of the testicle, the seminal vesicle, and the prostate in rats. So it clearly is something that helps to strengthen and rebuild the male reproductive system. And it contains dopamine, that reward hormone, so it likely has an effect against depression as well as lowering libido. Now, experimental data in male rats suggests that dopamine has an implication in sexual motivation as well as in copulatory performance, but the exact involvement and the control of sexual motivation and genital arousal in males isn't really understood. But a 2001 trial in the Medical University of South Paris concluded that central dopamine is a key neurotransmitter in the control of sexual function. And it has been noted that the same dopamine receptors that decrease with addictions are the primary ones involved with libido and erections. And it's also been noted that some heavy porn users report erectile dysfunction, which is considered to be due to kind of numbing their reward circuitry, which involves a decline in key dopamine receptors. So clearly dopamine has a strong effect in motivation, performance, and at times in absolute erectile dysfunction. We don't yet understand fully why, but there are so many things that science has not yet fully understood. And then there's horny goatweed. The Chinese goat herder noticed the effects on his flock, and that led to hundreds of years of use in traditional Chinese medicine as an aphrodisiac. It tonifies the kidneys and strengthens the yang. That's the strong male up and out, getting going energy. Now, of course, both men and female have yin and yang, and you want to strengthen women's yang as well to help them to get through life and get through their day and feel like having some fun at the end of it. It's used historically for impotence, for infertility, for involuntary ejaculation, and to restore sexual vitality. It increases coronary blood flow and vasodilation, so it increases the amount of blood that flows around the heart and feeds the heart and enables the heart to function better and dilates those blood vessels. It also assists in making nitric oxide from L-arginine, at least in rabbits, but it looks very much like it does that in humans also. And nitric oxide helps to relax other blood vessels. So you've got the heart flowing better, and you've got the heart pumping better, and the ability for the blood to flow better around the body by the relaxation of blood vessels. Because if the blood isn't getting to the organs that need them, they ain't going to work properly. And it also, horny goatweed also aids erectile function by increasing the cyclic AMP in the cavernous smooth muscle cells. Now, the cavernous smooth muscle cells are what makes up the corpus cavernosum, which is a hollow tube of spongy tissue that runs the length of the penis. And when the pockets of the sponge are empty, it's at its smallest and most pliable, but it enlarges and firms as the tissues fill with blood and the little pockets get full until that spongy framework is taut. Then there's Damiana, Turnera diffusa. This comes from Indian herbology, It's an aphrodisiac, a tonic, a stimulant, and it also reduces anxiety. It's a central nervous system tonic. It's especially useful for sexual inadequacies with a strong psychological or emotional component, whether it is those inadequacies are from senility or from abuse, and it is especially has more of an affinity for men. It's also known as a nerve tonic and an antidepressant, considered as specific for anxiety and depression where there's a sexual factor. So if there's a sexual problem with an emotional factor or an emotional problem with a sexual factor, Damiana really fits the bill. It may be used to strengthen the male sexual system, and alkaloids in it are thought to have a testosteronal effect, and it also contains constituents that are similar to caffeine, so that creates the stimulant effect, and it has relaxing cyanic glycosides that balance the stimulation effect, so that's how it can be a stimulant and reduce anxiety. It's known as being good for any debilitated condition of the nervous system, and more male-oriented with the quote of fatigue impotence, but it's not contraindicated for women with debilitated conditions. And it's another one that is thought to affect the nitric oxide pathway. Then there's good old maca, Lepidium mevenii. It's an Andean aphrodisiac and a male fertility enhancer. It certainly has been shown to increase fertility in rats. It improves erectile dysfunction and sexual dysfunction in healthy adult men in a systemic review of 4 human randomized controlled trials. It increased sexual desire in males in a human double-blind placebo-controlled randomized trial, and it's been shown to benefit people with erectile dysfunction due to the serotonin reuptake inhibitor antidepressants, Prozac and that family. And that was in a human double-blind randomized parallel group study. Maca also improved libido, sexual function, and experience in people on a variety of antidepressants, all or most of whom were women. There was about 50% of the people in that trial dropped out, and the vast majority who started were women, so most or all who finished would have been women. And that was a human double-blind randomized trial, and the effect was found to be dose-dependent in that. I certainly know a woman who was put on maca by her naturopathic doctor, and she went back and said, I'm a single woman. I don't need to increase my desire anymore. I'm not taking this stuff. Now, maca also helps emotional aspects of sexual health in healthy men and women. It helps mood balance during menopause in healthy women, and they looked specifically in that trial at anxiety, depression, and sexual dysfunction, and they found it didn't work via testosterone or estrogen. It must have worked via some other mechanism. And higher doses in the long term in women are more of a toner of hormonal processes. And I've also got a note here that 2 randomized controlled trials suggested a significant positive effect of maca on sexual dysfunction or sexual desire in healthy menopausal women. That's women who've gone through the perimenopausal period and they haven't had a menstrual period for at least a year. And then there's good old ginkgo biloba. It helped 76% of men and 91% of women with antidepressant-induced sexual dysfunction. And it helps in all 4 phases of sex: the desire, the excitement, so erection and lubrication, the orgasm, and the afterglow. In a trial of 50 men with proven erectile impotence, those who were responsive to drugs before the trial got spontaneous erections 6 months into the 9-month trial, and 63% of those who hadn't responded to drugs before the trial did respond to drugs after treatment. So those drugs would be like Viagra and other erectile dysfunction drugs. Ginkgo supports peripheral circulation. It's a vasodilator and a bronchodilator. So we've been talking about stimulating circulation in general through the system, getting the heart pumping, opening up the blood vessels, getting the blood flowing through the system. Ginkgo also supports oxygenation of that blood because you're dilating the bronchi, you're enabling more oxygen to get in, and in times of sex where there may be a significant amount of heavy breathing, I think that's really helpful. In ginkgo, also there are 5 alpha reductase inhibitor properties, so it benefits the prostate in cases of benign prostatic hypertrophy. And it increases dopamine and noradrenaline, and it reduces the cortisone reaction to stress. Now, dopamine is that reward hormone, and noradrenaline, of course, is one that gets you going and gives you energy. So good old ginkgo, we knew that it helped memory, and now we know that it helps to create happy memories as well. And then the B vitamins that are in both Satisfaction and Sensational, B3, B6, B12, and folate. Now, I know that folks who work in health food stores know a significant amount about B vitamins, so I'm just going to go through this quite quickly as to why these particular ones have specific uses in these particular formulations. So B3, we're using it to improve circulation. Now, that 50 milligram in each capsule may trigger the niacin flush in some people. You know that works. It's about 10 to 30 minutes long, sort of a heat and a prickling sensation. There may even be some reddening of the skin. And if somebody doesn't like that and wants to reduce that excess flushing at first, they can start with 1 capsule twice a day and take it with food until tolerance is built up to take 2 at once with or without food. But for those who like that feeling, it has been reported to increase orgasmic intensity, the sexual flush, in both sexes, especially if taken shortly before sex. So the user can work out how it is it works for them to give them the least discomfort and the greatest enjoyment. And if there is a niacin flush at first, of course, people get acclimatized to niacin easily, and after a while that won't happen. So if people are looking to enjoy that sexual flush, they might want to start and stop with the product. If they don't want to, then they should take it on a more ongoing basis. And B3 is necessary at a certain level in the uterus for females to actually achieve orgasm. It was Masters and Johnson who found that out. And then B6 in the pyridoxine form, not the pyridoxal form, and the pyridoxine form is the one in these products, helps to control elevated prolactin, and elevated prolactin lowers libido. B6 also helps tryptophan to enter the brain and to convert into serotonin, so it's got some feel-good factors in that aspect. And then B12 supports nerve function and energy. A deficiency is associated with low energy, low libido, and erectile dysfunction. And low folate levels are also associated with erectile dysfunction, and they're associated with premature ejaculation. So those are all of the products, all of the ingredients that are in both products, because they help the sexual health of both men and women. And now we're moving on to the ones that are just in the product for men, Satisfaction, because they work better for men. Their focus is on getting an erection and having more energy. They are Korean ginseng, which is Panax ginseng, saw palmetto, which is Serenoa repens, L-arginine, which is an amino acid, and green tea, which is Camellia sinensis. Korean ginseng significantly improved erections. It improved their rigidity, the amount of penetration, the maintenance, and it reduced premature ejaculation, and all of these by the 8th week in a trial when it was used as a single herb. It also relaxes the corpus cavernosum, so helps to enable the blood to flow into the parts of the penis that enable erection. And it increases oxygen uptake, so you've got the ginkgo increasing bronchodilation, you've got the ginseng increasing that oxygen uptake, together in synergy with the other herbs and nutrients that create more blood vessel dilation and enable more blood flow. Korean ginseng also helps with the effects of stress and fatigue, both physical and mental, and it increases endurance and performance during exercise. So I think if it does during general exercise, we can assume that it increases performance during horizontal exercise. And in Chinese medicine, it reinforces qi. Saw palmetto is a male productive system tonic. It's indicated for impotence and reduced sex drive. It's been shown to reduce sexual dysfunction and to improve benign prostatic hypertrophy symptoms. It tones the male reproductive system, especially the prostate, and especially when combined with Damiana. So these two herbs are recommended to improve reproductive performance when this is kind of flagging, and for debility and senility in men. And it's another herb that has some 5-alpha reductase inhibitor function that benefits the prostate. It's been found to be more effective when there's only mild hyperplasia. And of course, benign prostatic hypertrophy, which 5-alpha reductase inhibition assists against, is a major risk factor for sexual dysfunctions. Now, green tea, Camellia sinensis, it's a caffeine source for energy and performance, and it's a source of antioxidant for good general health. It's also been shown to reduce urinary tract symptoms, so it may reduce benign prostatic hypertrophy. And green tea polyphenols delay the development and progression of prostate cancer, so we know that they're helpful for the male reproductive system. Then there's L-arginine. Now, L-arginine is the nutrient most famous for helping the body to produce and use more nitric oxide. L-arginine is a precursor to nitric oxide, and nitric oxide promotes the dilation of blood vessels in general and blood vessels of the penis as part of that, and it relaxes the muscles of the smooth muscles of the corpus cavernosum, which, as I said before, those are the ones which enable the blood to come into the penis and create the erection and maintain the erection. And with L-arginine, in a human double-blind placebo-controlled study, 39% of people improved sexual function when they took L-arginine, compared with 12% of people who only took the placebo. It was shown to have a better response in men whose blood vessels are healthy, and of course that makes sense because the more atherosclerotic plaque somebody has on a blood vessel, the harder it is, so the less it's going to be able to relax when stimulated by nitric oxide. Now, it was interesting that the lower the nitric oxide level that the person had to start with, the better the response was. So it helps those in most need of it. And it is an amino acid. Amino acids are the building blocks of protein. The typical diet contains 5 to 6 grams a day. People who are on a high-protein diet are likely to be ingesting more of it. People who are on a low-protein diet or a vegan diet may well be ingesting less of it and need more to help them. Then there's zinc. Zinc is used up in the ejaculate. I always give a bottle of zinc to any couple who are going off on honeymoon. It's one of my wedding gifts to people. Now, severe zinc deficiency causes erectile dysfunction, low serum testosterone, hypogonadism, as in small testicles, low sperm count, infertility, benign prostatic hypertrophy, and prostatitis, as in inflammation of the prostate. And it's also associated with depression, ADHD, attention deficit hyperactive disorder, and anorexia. So we can see that zinc affects people physically and mentally, emotionally. Some blood pressure medications reduce zinc by increasing the urinary excretion. Those include angiotensin conversion enzyme inhibitors, ACE inhibitors, and the drugs which are of that class, their name's enzinpril, PRIL, so that's how you can tell that class. They're the ones, 20% of which give people a dry cough. Other medications that reduce zinc levels are diuretics and, surprisingly enough, aspirin. Now, the typical Western diet is low in zinc, but also a diet that's high in fiber and phytates may reduce zinc. And, of course, phytates are around in nuts, seeds, beans, legumes, and grains. So typical Western diet, not great. Good vegan, whole food diet also may have effects on zinc. And there aren't any reliable tests for zinc levels. Blood tests are still a bit iffy. So things that I have used and other people I know have used to look at zinc deficiency are white spots on nails which haven't been caused by trauma are considered to indicate a deficiency. And there was a nutritionist who taught us at Naturopathic College who said that a reduced angle of erection was considered to indicate reduced zinc status. Now, her way of checking it out was if you hold your hand out with the thumb pointing directly upwards and the fingers splayed as wide as they can be, if the angle of the erection is the same as the angle of the first finger, then that person's got enough zinc. But if it's the second finger, oh, they're a bit depleted. Third or fourth fingers, and it's like, oh, you are low in zinc. And now we come onto the ingredients that are only in Sensational, the product for women. And these ingredients focus on getting in the mood, getting nice and relaxed, and increasing enjoyment at every stage of the process. They are ashwagandha, which is Withania somnifera, hops, which is Humulus lupulus, and then the 3 B vitamins, B1, B2, and B5. Those are thiamine, riboflavin, and pantothenic acid. Ashwagandha, what a wonderful substance. It's an Ayurvedic nutritive tonic for general debility, especially during convalescence and old age. It's been shown to improve sexual function, arousal, lubrication, and orgasm in a human randomized placebo-controlled trial. It had a lesser effect on desire. It did increase desire, but not to a degree that counted as significant in the way that you have to have certain numbers to show significance in clinical trials. But all of the other factors, the sexual function, the arousal, lubrication, and orgasm, were all significant increases with ashwagandha. Ashwagandha also decreases serum cortisol in the chronically stressed, because, of course, high levels of serum cortisol are associated with gonadal and sexual dysfunction. And women have gonads too, of course. Our ovaries are the equivalent of the male testicles, so ashwagandha helps ovarian health. And that was a human double-blind randomized placebo-controlled trial. Animal trials have shown that it helps in stress-induced sexual dysfunction, and it's an adaptogen. It restores adrenal function, and it can increase DHEA sulfate and offset androgen deficiency syndrome. And testosterone is our main androgen, and of course women need testosterone for a good libido, just as men do. We have less than men, but we all need enough for ourselves. And ashwagandha also enhances mood and energy. It reduces anxiety, and in Ayurvedic medicine, it is used to balance agitated vata. Now, vata is the element associated with kind of air and ether, and it governs all movement in the mind and body, and it controls blood flow. It also controls breathing and the movements of thoughts across the mind. So all of those things are pertinent to having a good sex life. And then there's hops, Humulus lupulus. This was found to affect women's hormones when hop pickers recognized that shortly after starting hop picking, the women would all start menstruating. So that was just historical evidence that pointed to its potential use. Hops helps with desire disorder, and traditionally it's used as a calmative to relieve nervousness. It's indicated for nervous irritation, anxiety, and excitability. It also helps in exhaustion and with nervous tension headaches. So all of those are good things for your overworked, exhausted housewife who really is like, not tonight, honey. Oh, I'm so tense and I've got a headache. But with hops, it's important to note that it is contraindicated for anergic depression. Now, you will see some places where it says contraindicated in all depression, but if you look more specifically, it's contraindicated for anergic depression, which is depression with low energy and no anxiety. The other herbs in the formulation may balance it out, but women with that kind of depression should be made aware of it because it relaxes them and it can lower energy and increase depression. So care with that one in those circumstances, but it is indicated for depression with anxiety, and I do find that most depression in most patients that I see, there is anxiety in there. And then the B vitamins. B1 and B2 support the nervous system and the metabolism of foods. B5, of course, important for production of sex hormones and stress-related hormones in the adrenal glands. B6 is known to help balance hormonal changes in women, helps lots of women with PMS. And B12 and folate are necessary for red blood formation, which is more important for menstruating women. And of course, B6 and B12, I spoke earlier about other benefits that they have for everybody. So with all of this support for all of these different aspects of sexual health in these products, one is looking to get much more happiness, fun, and relaxation thereafter in paradise. So the last important part, who shouldn't use these medications, or who should use them with care, or I should say these products. People on blood thinning drugs shouldn't use them. They're contraindicated due to the herbal contents, especially the ginkgo. And there are more drug thinning products on the market these days. The most common names, the older ones, are heparin and warfarin or coumadin. But the new ones, which are not so affected by the whole vitamin K situation, but which actually cannot be antidoted, are Eliquis, Pradaxa, Savisa, and Xarelto. Another time that these products should not be taken is around surgery. People should stop a few weeks before. Saw palmetto was associated with just one case of hemorrhage during surgery. Then you've got ginkgo, which is known as being a bit of a blood thinner, so always better to be safe than sorry. And then hormone-sensitive cancers, breast cancers, prostate cancers, those are contraindicated because although a lot of these herbs do work in ways that may not involve changing hormone levels, some of them appear to change hormone levels, and we have to be completely safe and careful in cancer cases. Satisfaction shouldn't be taken with Viagra or other erectile dysfunction medications. Sensational shouldn't be taken when people are pregnant or breastfeeding. Now, Satisfaction, Punctivine is contraindicated in benign prostatic hypertrophy, but then, of course, there are a number of other herbs in the product that are beneficial for benign prostatic hypertrophy. So I guess actually this should be a caution, not a contraindication. But if somebody does have benign prostatic hypertrophy, particularly if they had it to any significant degree, then I would suggest that they have things monitored. If they want to use this Satisfaction, they make sure that they get a baseline checked and they get their situation monitored. And then gout sufferers, apparently, now I can't remember which herb it is. I do apologize, but there's something in there that competes with uric acid excretion. So anyone with gout is not going to want to have a situation with increasing their probability of having a gout attack. I think that would put one off sex completely. So cautions, low blood pressure. Because the nitric oxide is opening up those blood vessels so the blood can flow more freely, it's reducing the blood pressure. And if somebody already has low blood pressure, then they should monitor how these products affect their blood pressure, because basically if your blood pressure gets too low, you can pass out. Now, in particular, Sensational may potentiate hypnotics and alcohol. That caution is mostly due to the hops that is in Sensational. Irritable bowel syndrome, larger quantities of Damiana can irritate IBS. Again, there may not be enough in these products to do so, depending on how sensitive the person who's taking them is, but you might want to take care around that, mention that. And again, hops is contraindicated for allergic depression. It shouldn't be taken with other medications or natural health products that have sedative properties. And of course, Satisfaction contains stimulating herbs, in particular the ginseng, so it may affect the ability of the man to sleep after taking it. So maybe some afternoon delight in a weekend is better indicated, or maybe it'll enable him to stay awake enough to say a couple of sentences before he falls asleep on you. And now if anybody has any questions, I'm very happy to answer those. And of course, the last slide in this webinar shows the prize-winning questions, the questions that if you answer them and send those answers into the email address at the bottom there, webinar@enerex.ca, that you will, and if you then also send in your full name, the store name, the subject line of the February 17th webinar, and your choice of Enerex product, you will receive a product of your choice. Thank you everybody for taking time out of your busy schedules to listen to this. And if anybody has a question, please do let me know.